welcome to the AI GovSec discussion series. I'm Aditya Chotia, an AI governance and security enthusiast. I've spent 13 plus years in the cybersecurity, IT risk and compliance space. This series exists because AI is moving faster than the governance frameworks meant to control it. Every week, I sit down with industry leads, with CISO security leaders, and everybody is worried. Everybody doesn't know what's coming. Hence, I've created this to actually understand and see what everybody is doing, what's working, what's not working when it comes to AI, governance, and security. No theory, just practical conversations about how organizations are navigating the gap between AI adoption and the controls needed to manage it. Whether you are a security leader trying to get ahead of the AI risk or a practitioner building in this space, this is for you. Let's get into it. So, thanks a lot, Chris, for taking out time to join the AI GovSec discovery session with me. I'm really happy that you are part of this and you're sharing your gem of knowledge with us. Just for the audience, because you are on the other side of the pond from us, would you mind giving a quick introduction about yourself?
Most certainly. Thanks, Eddie, for having me today. Looking forward to the chat. Yeah, Chris Neal. I'm the Group Chief Information Security Officer for Ramsay Health Care. I've been with Ramsay, July will be 10 years, so a day or two. For those who don't know Ramsay, Australian founded, Australian headquartered company, private healthcare. So we run, in Australia, we run private hospitals predominantly, hospitals, day surgery clinics, but also rehab and mental health. And then we have in the UK, two separate businesses. There's Ramsay UK, who run private hospitals, and rehab facilities. Then a separate business called Elysium Healthcare, who run mental health facilities in the UK. And then we have quite a large presence in France. We're actually the largest private operator in France with Ramsay Santé. And then we run Ramsay Santé in France is predominantly hospital, rehab, mental health. Large business in Sweden that runs a couple of hospitals, but mostly primary healthcare, so general practitioners, optometrists, dentists, that sort of thing. Similar in Norway, and then our Danish business, slightly different again, all sort of day surgery, day procedure kind of clinics. So all up, we're about 500 facilities around the world, about 90,000 staff all up. But each region operates entirely separately. But my role, kind of a bit dual speed. So my group role is really a second line role, looking at oversight and governance across the group, with sort of dotted line reporting for the individual security teams in each region, who do the actual technology delivery and run. But then I also oversee the first line work for the Australian business.
Right. It does sounds like a big tech landscape over there, and a big sort of, you're handling a lot, and it's all sort of global scale as well. So I would be curious to dive into the background and what you are doing every day. So let's straight jump into it. So I'll first start with putting the context and start with your background, and then probably we'll move into the wider AI security and governance in healthcare bit. So as you said yourself, right? I think so. You have been CISO at Ramsay for like over a decade, and you'll be completing 10 years or so, right? And you oversee cyber across multiple countries, as you mentioned. Can you briefly mention how your role has evolved when you started sort of back over the decade and now, and particularly the shift between the first line operational activity to the second line board assurance?
Yeah, so when I joined Ramsay, the role was just for Australia. So it was just for Australia. It was at that point there was some desire for how do we group cyber up and collaborate better and get better overall visibility. So, I spent a couple of years trying to telling the organization, well, if you want that, you need a global CISO or Group CISO. After about 5 years of that, they agreed and said, you can do that too. But it was really starting from scratch in terms of, okay, what does group reporting look like? How do we talk? And again, as I said, we run entirely separate technology stacks. There's no network connectivity between regions. So how do you get to, what does board reporting look like? What does that oversight look like in a way that becomes, to an extent, technology agnostic, because the systems are different, other than everyone uses Microsoft. We're not getting away from that, but after that, commonality drops away pretty quickly. So the first probably year was working through with the various cyber teams, security teams in the regions, and as well as senior executive about how do we as a group want to talk about this? What does this look like? And that evolved through. We put together a couple of internally defined control frameworks in terms of, okay, here's the baselines. Here's what control, not specific technology, but what are the controls you should have in place. Went through a few rounds of uplift on that, and then a couple of years ago, probably two years ago, two-ish, landed on everyone had kind of got to a decent baseline for all the internally defined control frameworks. So made the decision to move to an external framework, move to NIST CSF. And there are different parts of the group that use ISO for certain things, particularly our UK business, because the NHS likes ISO. But we kind of wanted something that was not just a management framework, but was also, was a broader control framework. The ISO 27000 series are great as a management control framework. An ISMS, no problem. They don't really generally go to the next level of detail in terms of, okay, how should the controls actually work? And we wanted to get a little more prescriptive than 27001 without going to, okay, we're going to try and run the same cyber stack, security stack across everywhere, because getting 6 entities to agree on, we're all going to run CrowdStrike, or we're going to run SentinelOne, was more effort than it was worth at the time. We're now starting to push towards a bit more of that, but it's more opportunistic than, three out of the 6 have found this technology works. How about we try and standardize on that sort of thing? But it's been evolving, both the board's understanding and the board, what the board wants to see, because directors are clear, they want to see something. Are they clear on what they want to see? No, which is fine, right? That's they're not cyber experts. I am. So it's been a few iterative rounds of, okay, I think this will deliver you what you want in terms of the assurance, because at the end of the day, the board's looking. Boards are looking for, do we know where our problems are, or our risks, vulnerabilities are? Do we know where they are? Do we know what to do about them? And are we managing that risk? End of the day, their interest in cyber is because many organizations don't really know where their vulnerabilities are and don't have a good plan. That's why directors get nervous, right? So it's, in many ways, it's taking problems they understand in terms of there's a risk, there's something you need to do about it, and you need to make sure someone's accountable for getting that done. Applying that to any and all cyber risks or technology risks or AI risks.
Got it. And I think I completely resonate with that. And I think what I heard over there was the way it has been a journey for yourself as well, and for the organization in this, from getting to that sort of individual fragmented control frameworks to getting more externally aligned, sort of NIST and ISO aligned sort of frameworks. And then the other challenge was that, yes, senior leaders want to see the needle moving, but how do you move the needle, or how do you, what makes them get out of their chair is what we need to figure out. It's a journey in itself. And the third I was trying to hear there was, how do you juggle between a fragmented business where each leader is captain of his own ship, multi-country, and then how do you get all of them on board and drive it through together so that you're not breaking individual business but creating more robustness in there?
Yeah, and certainly on that third one, for me, there's a couple elements to it. There's a lot of collaboration and consensus building, right? Culturally, telling the French what to do is challenging, but if you paint the picture and you get let everyone come together, express their views, express their why they think X, Y, or Z should be the answer, and you can get to a collective agreement, then that works. Because as you say, right, my role is about influence and oversight, not direction, at least outside of Australia. In Australia, for the Australian business, I can be directive. But for the others, it's about, okay, these are the risks. We agree. These are the type of risks we're facing, right? Do we agree on that? Do we agree on what we should do about it, right? And that, do we all agree patching's a challenge? Yeah, we do. Of course, that's an easy one, right? But okay, do we agree we need to do something about it? What are not necessarily the technologies, but what are the approaches? What's worked in our Swedish business? How can we apply that elsewhere? So it's about that consensus building, but also taking the advantage or an advantage, possible advantage of a federated organization like this is everyone can try something, and then you can actually see what works. And then, okay, well, that worked for you. This didn't work for us. So we'll do it how you did it.
Exactly.
Rather than trying to get it perfect everywhere the first time.
No, aligned with that. Also, I think when I was going through your profile, and I think you have a little bit unusual academic background as well. You have a master in philosophy of technology, if I'm not wrong, with a focus on cybernetics. And just out of curiosity, how has that shaped your thought process about security, risk, relationship between human and technology?
So it's certainly given me some, I think, given me some good perspective on the human side of security, and the technology is just a tool. It's a tool. Technology is a tool, or a series of tools we use to make our lives better. Hopefully, that's the goal. So it's led me to the philosophy approach. It's not about the technology for me. It's about how are we applying the technology? How are we using the technology to make our organization safer? And in the case of Ramsay Health Care, how are we using technology to better treat patients, and or to make our staff's life easier so they have more mental bandwidth to be treating patients? There's not a lot of value for me if a nurse is distracted by the technology or distracted by security, and that takes away from their focus of treating a patient. There's no win in that for me. So it's about how do we focus on how people use the technology? How do we focus on how the technology helps them rather than the technology for itself?
Got it. No, aligned with that. I think if I'm not wrong again, you have created a fusion function at Ramsay where it's like you're trying to bring together and manage together the joint biomedical or the med tech and the whole cybersecurity risks in the internal tech landscape. And obviously, with what's going on with AI getting embedded right, left, and center across all the sort of these medical devices, I don't know how in your view that changes the risk profile from a CISO perspective of this massive organization. And then on the back of that, what are the AI specific threats, specifically on the medtech which sort of keeps you up at night?
So predominantly, if we're talking about this sort of predictive AI or machine learning, that doesn't worry me too much, if I'm frank. The models for how you assess clinical effectiveness of those tools are pretty well understood. It can take some time and effort in clinical trial and all that good stuff, but those are known processes. The bit around AI that does worry me is particularly on the generative AI side. Because as much as everyone I speak to still very much hardcore on, it's human in the loop. It's AI supporting clinicians, not replacing clinicians, which I wholeheartedly agree with. But the bit that worries me is when if the clinician's accountable for the output and signing off the output of the AI tool, which I think is the right model. In my mind, the thing that scares me there is when the model is 75% right, clinicians are going to review the output really carefully and correct mistakes.
Mm-hmm.
When the output gets to 99% accurate, people are going to stop looking carefully. And that's not any slight on clinicians. That is human nature. That is human psychology, right?
Mm-hmm.
And where that 1% error is not clinically important, cool, that's fine. But if that 1% error includes we're giving someone milligrams of morphine rather than micrograms, that's bad. That's the bit of at the minute at least the bit of AI in healthcare that worries me. And how do we get? Because I don't think there's a technology solution for that problem. I think that's a clinical governance, clinical risk management question. And how do we apply what we have? Because doctors make mistakes today, right? Without AI, mistakes get made. And there's whole procedures around medication management and how do you make sure that someone doesn't accidentally type milligram versus microgram. I don't think as an industry, I haven't seen anyone really think deeply about applying the controls we use today outside of AI. How do we make those more into the AI tools so we're reducing the errors will happen? How do we make sure we're able to identify and reduce the impact of that error?
Got it. And this is really interesting because I'm having a lot of conversations and we have picked up this who owns the decision of the outcome of AI and human in the loop, approval by the human. But you have raised a very important sort of a new area, which is like when AI is 80% right, that's fine. We know human will fix it. But then when AI start to get 99.5% right at that point, because with that human psychology, people will start, it's all correct, let it pass through.
Yeah.
How do you put guardrails on that thing? This is really, really interesting. No, I agree. And also because you mentioned on the Gen AI and from an ML perspective, and I know you also recently did a speech at the Medical Software Industry Association for the sort of cybersecurity requirements for medical software and devices. And I'm trying to ask this because at least in the UK, we have seen a lot of third-party risk management getting exploited in the last year or so. So from your perspective, where do you sit in healthcare and with your position? What are the biggest gaps you see in how these these vendors approach AI security in their devices, in their SaaS tools? If you've got any view in there.
So my concerns about how many of them and why I actually agreed to do that talk to the Software Association before you get to AI, certainly I can't speak to the UK market in detail, but I'm going to go out on a limb and bet there's some commonality, because I see the same out of a lot of the US vendors. Before we get to AI, they're not doing security well in their software. So I think adding AI is going to just exacerbate that problem. Particularly, people are adding a lot of AI, generative AI tools to a lot of things quickly for speed to market reasons, which I appreciate. But speed to market does not always mean speed to quality. So my concern at this point is, medical software or software as a medical device or even device manufacturer, if they were doing cybersecurity well, if they were securing their product well without adding AI, they're probably going to do okay when they add AI, because they've already got the process right. They've got a lot of the thinking right. If they weren't doing it well, and I won't name anyone, but I've got lots of examples where the application, the software architecture is poor, the ability to patch or update or even identify vulnerabilities is challenged on a good day. For those organizations, I think adding generative AI tools into their software will only make those problems worse.
Got it.
Which then leads to another, increased vector for how those tools could be used or abused to either breach a hospital operator or a healthcare provider, or negatively impact a patient.
And because I do see a lot of industry leaders like yourself do think similarly. And what I've seen, the key challenge in some of those areas is up until what level you go to do your vendor risk management. So for example, you have a direct vendor, and then that has another vendor to support that services which he's providing to yourself, and then that vendor has another vendor. So multiple layers of vendor, and there's no framework for like you can go to up until fourth vendor, 10th vendor.
And I've seen organizations try go to not just third but fourth, fifth. I've even seen one try to go to sixth party. My personal view, I think that way lies madness. I think you need to be clear with the third party, right? So the organization you're actually contracting with, because that's the only point you actually have leverage, right? Right. That's where you're contracting. You can, some of our board have said this, right? We need to do appropriate due diligence for our third parties, but at the end of the day, the only real control you have is the contract. Right.
Yeah.
Right. So understand where the risk is, but make sure the contract's solid. And I think I do think trying to go beyond third party, unless you're a very large organization who wants to spend a lot of money on this, because your third party is going to change who they work with over time. Does that mean you have to go back and remap their entire supply chain every 6 months? And that's doable with enough people and time and money. It's doable, but is it, globally? I'll speak about healthcare and health delivery organizations broadly. Economically, we're all challenged globally, right? No one's swimming in money. Is trying to do that sort of, remapping your third party supply chain to the fourth or fifth or sixth party. You can do it. You're going to spend a lot of money. Is that the best use of your cyber spend? Are there other things you could do with that investment to actually better secure the organization?
No, understand. Yeah, completely get the perspective. Yeah, yeah. And just on that, because this is becoming again a hot topic when I'm speaking to a lot of industry leads, is like every other day one of the third party where their organization has bought like a SaaS solution, activating the Gen AI chatbot or activating an AI agent just to help in the processes for the customers. And then suddenly every other day you have to do this whole discovery exercise of what are the AI tools sitting within the organization, but then within these SaaS tools, where they are reading or getting access to the organization's data. And and is there any detailed discovery which needs to happen for this? That's a big question mark to all the security leads who at least I'm speaking to, and I don't know what your thoughts are regarding. I think the industry calls it a shadow AI phenomenon. So I don't know if you've got a view on that.
Yeah, so a few, and I think the use of generative AI tools in SaaS products, I think, is inevitable. And today there are some solutions where you can, as a customer, you have the option to turn that off. Those options are diminishing rapidly, and there are a number of platforms we've bought in the last 6 months that you can't turn it off because it's integral to how the product works. So for those, in my mind, it's not so much a deep dive on which of the SaaS tools are using Gen AI. I think it's a deep dive on what in your organization do the SaaS tools have access to.
Right.
And I'm not saying we've implemented that fully or anything, right? But that's philosophically, that's how I come at it. Because if the SaaS tool has access to information you don't want it to have access to, even without a Gen AI, that's a problem, right? And the example that gets used a lot is Copilot, right? Copilot. If you turn on Copilot against your SharePoint Online environment, it will give a user answers based on what they have access to. If they have access to information you don't actually want them to have access to, Copilot can still give them the answer. Now, that's not Copilot's fault. That's the user always had access to the information. They just didn't know it. Right? And they couldn't. Their search skills weren't such that they were going to go find that spreadsheet full of payroll data, as an example. But Copilot will find it for them. But that's an access permission problem, not an AI problem in my mind. Right?
Yeah. This example resonates with me so much because like last couple of weeks, I'm having conversations and organizations just tell me that, yeah, we don't use any other AI tool. We've got Copilot sorted. It's just internal Microsoft tool. Everything is covered, but they don't think about what Copilot can access. It's actually the user's access, which needs to be sorted on your Microsoft SharePoint M365 versus, it's about the data rather than the Copilot. So 100% with you on there. Right. So we talked about some of the risks and human in the loops and the problems with AI brings right now. And obviously, as we just talked about the data as well, with your role in a healthcare organization, healthcare being the most sensitive sort of carrier of the sensitive data, how do you think about AI governance in the last couple of years, and how has evolved, being sort of using AI tools both internally and externally, like employee using Gen AI tools? Is there anything like framework wise you want to share? Any thoughts there?
Without getting too deep into how we do governance, but it's we've taken very much a multidisciplinary approach, right? We have an AI governance committee, council, I can't remember, one of the two, with a broad stakeholder base, right? So I'm a member, the CIO is a member, the chief risk officer is a member, but we also got clinical representation, HR representation, and of course the lawyers are there, And because it's, in my mind, there's security elements to this, of course. But there's also, how do we best use the technology? How do we make sure we're using the technology within the bounds of appropriate privacy controls and consent? And certainly, in healthcare, privacy and consent are not part of the security problem. That's a separate privacy team, for which I'm deeply thankful, I'll be frank. But also from a clinical perspective and a medical ethics, are we using it ethically? Right? And how do you? So I think broadly, I'd say a governance framework that brings all of those elements together as equal weight. Right? There's no point in me saying, yeah, that's fine from security, go for it, and the medical ethics guys are like, yeah, no, that's a disaster. Right? It needs to be. Everyone needs to. Not everyone in the organization, but the right stakeholders need to be part of the conversation to have a clear and frank conversation around, okay, here's where I see cyber risk, here's where clinicians see clinical risk, here's where the medical ethics people see concerns, here's where the privacy folks see concerns around consent. Okay, is there enough benefit in using this tool to solve each of those challenges, or not, right? Because at the end of the day, and this is a point I've made a few times recently, AI is just a tool. What's the problem? What's the business problem you're trying to solve, or the operational problem you're trying to solve? Let's be crisp on that. And then we can work through, is Gen AI a good tool to help solve that problem? And Gen AI can help solve a lot of problems, right? But it is just a tool. It's not an end to itself. And you don't deploy AI. You deploy AI to do something. And I think, if I'm frank, I think there's still a bit of we're still, I think, a little on the, we haven't got all the way through the Gartner hype cycle on this yet.
No, I agree, and this sort of resonates. And I think what I've heard over there is, it's ultimately about the business and ultimately about the business problem which you're trying to solve with that tool. And it could be a software, which is in this case an AI. So every software will come with its own set of risks. So obviously you need to put that lens of specificity of what type of software it is. But then ultimately it's the business problem which you need to look at, rather than, no, this does make sense. And just on this one, because as I'm speaking with a lot of CISOs and security leaders, I'm trying to create two camps, or by now they have been bucketed into two camps. This is regarding the employees' usage of their Gen AI tools like ChatGPT's Gemini. The one bucket is sort of a view that you should open up everything for employees so that they can harness the productivity, and because each model is good for one sort of use case, or other model is good at sort of building presentation, but the other model is good at writing. But then you should give them these models, and then you should monitor what they are doing with it. And the other camp is just block everything and only give them one tool which is approved by your organizations, like Copilot or Google Gemini. Do you have a view in this? Where
I do, and I fall in the first camp. I'll be honest. I think this space is moving too fast to be able to pick a tool and say, this is the corporate approved tool, this is the only thing you can use. I think it's, but I do think it is important that we, as technology teams, and I am part of the technology team at the end of the day, are delivering solutions to the business that the approved solution, the sanctioned solution, is as good as we can make it, and encourage people to use that rather than Bob's AI. But I know none of us are moving fast enough, particularly in healthcare, to be able to say, yeah, what we've deployed as the corporate approved tool is the best thing for all use cases. So we're going to block everything else. I think it's, broadly allow, monitor, keep a close eye on
Mm-hmm.
what people are doing, right? If someone's trying to upload a spreadsheet with 100,000 rows of patient record to DeepSeek, maybe we don't want that, right? But that's DLP again, right? That's a data loss prevention problem. So I think allow, monitor, but encourage use of the corporate tool for where there is a corporate tool. Encourage use of that rather than Bob's model down the road.
Yeah, no, understand. I agree there. And just sort of taking a circle back to the start about Ramsay, and because I'm touching about the AI governance and the regulations which are coming on, right? So obviously it's a global organization, as we talked about, operates in multiple countries, Australia, UK, Sweden, and a lot more. Each of these countries has different view on AI regulations, and they are in different phases of forming the regulation, or no regulation at all. Obviously, with this, the EU AI Act is a little bit ahead, a little bit faster, and obviously it's going to impact Ramsay, right? So, what's your view on these multiple AI regulations which is coming on, building, and how are you just high level preparing?
So I'll kind of answer in two parts. I think because in my mind, there's two ways to approach this. If you're an organization, unlike Ramsay, if you're a global organization that was deeply interconnected, then honestly, the only way to deal with it is pick whichever regulation is the most stringent and comply with that everywhere. Because anything else, you're going to hurt yourself, right? For Ramsay, given we are a federated organization, right? We can make separate decisions in different geographies without impacting the others. How we're approaching it is we have a high level framework, a governance framework about how we think about it, as I spoke about earlier. But then we leave to each region to work through what does that mean in the context of the regulation they need to adhere to, right? What is their government going to hold them to?
Right.
And if you're a federated organization, you can do that. I think that's much easier, right? There's some other, that comes with some other challenges in terms of how do you share data if you want to share data. It's not a panacea, but it is at least a little more, in my mind, a little more manageable if you can say, okay, well, each region can, we've got a high-level governance framework. This is the corporate expectation of how you're going to think about it, how you're going to think about those trade-offs, but then you get to implement based on what you're going to be held to from a local regulation perspective.
Got it. Yeah, I think this is one of the ideal ways to do it, right? Where you've got sort of a fragmented organization and you create a centrally set of principles, guidances, and then each can take those guidance and shape it in their local way, how to take that, interpret that, and manage that risk. Because I agree, in that fragmented sort of world, you can't from the top lay down the actual process and how do you handle. So aligned. Agree with that.
Yeah, and even if we could, there's no, I don't see a benefit, right? If regulation in France is such that you're really constrained in terms of what you can do with AI, do you want to apply those same constraints everywhere? Where it's, in Australia, the regulation hasn't evolved as quickly. I'm sure some's coming, but it hasn't evolved as quickly. So there's, we have some greater freedom to try different things. So how about why would you want to constrain yourself if you don't have to?
Yeah. And with you mentioning Australia over there, so just next thing to understand that a bit more, because you will know better than us and the audience, is obviously you sit in the Singapore Ministry of Health Care from a cybersecurity advisory panel as well, so you're much closer to how things are getting developed over there. And we just talked about sort of EU AI Act as well. based on your local knowledge, do you know where Australia is sitting in terms of regulating AI or specifically in healthcare? And
So I've not seen anything specific to healthcare around AI regulation in Australia.
Mhm.
The Australian government has issued some voluntary guidance on how organizations should govern AI, but it's voluntary. Right?
Right.
It's voluntary guidance, so you can take it or not. They have telegraphed that at some point that voluntary guidance will become mandatory guidance, and you'll need to do something.
Right.
But timeline unclear, and that's a political question as much as anything else, right? It's because that's how much pressure is the government feeling? What other political priorities do they have? What other legislation do they want to pass?
Mhm.
Will determine where on the priority list that falls. And my current gut feeling, I may be wrong. I haven't caught up with our government relations folk for a little while on this. I don't think it's any time particularly soon in Australia.
Got it. Because I know Singapore is evolving quite fast as well, right, in these
Yeah.
AI regulations and advisory, which is really, really good.
Yeah, the Singaporeans are obviously it's a much smaller geography, much smaller population, fewer levels of government, so that they can move a little faster. And they are certainly moving faster on AI. They've done some really interesting stuff on security testing of medical devices as well. So they're able to move a bit faster, which is interesting to learn from at least.
No, agreed. And going back to your second line role, and how do you present assurance to the board, specifically because obviously what I have seen boards and audit committees sort of talk about a lot more in the last 2 years is what are we doing for AI risks? How are we addressing these AI risks in the organizations? And based on your experience, because you wear both hats and you've got this multi-geography discipline, how do you translate that to what they can understand and what they can take back? Like this, like, yeah, we've got it. It's not out in the open. We are controlling it in a way which makes sense. How do you answer that question to ARCs and boards, and anything which you can share with your fellow peers as a guidance?
It's kind of what I've already said, right? It's we've broadly taken we describe it as we've got a governance framework that applies across the globe. Here is the individual variance in terms of this is what it means for in a bit more detail for France and the UK versus Sweden versus Australia. And everyone, and this is what we're seeing in the monitoring in terms of usage. People, we've got a corporate approved tool, and not every part of the organization has got there yet, but a couple have. This is what adoption's looking like. So we're seeing more people use the internal tool than going and trying to use ChatGPT, for example. And as long as we can, that demonstrates we're on top of it, we're monitoring it, and we can, if that trend starts going the wrong way, then we at least know, right? And we can start taking management action. Okay, well, why? Understand if people are trending away from the corporate approved tool to something else, we can go understand why, right? We've got some data. We can dig into the data in terms of, okay, what's driving them? What isn't the tool or corporate approved tool doing that they need? Because they're making a choice. 99% of the time, they'll be making a choice because the corporate tool isn't doing something they want, right? It's not generally not going to be, because I'll be frank, most of our staff are not technologists, right? They're healthcare professionals. If you give them, here's a tool and it does what they need, they're not going to go they're not going to go looking for something else.
Yeah.
Right. So we've at least got, so part of what we talked to the board about is we've got this is the telemetry we've got. This is how we know if people are starting to use different things, so we can get on top of it and understand why. And for a period of time, maybe that's okay until we either update or make some changes to the corporate approved tool to cover what it wasn't doing, cover what that gap was.
Yeah, no, make complete sense. Make complete sense. Now, looking ahead, obviously a lot is going on already, and the speed of how things are evolving has sort of accelerated very fast. So looking ahead 12 to 24 months, what do you think healthcare CISOs wish they would have started on earlier from an AI security and governance point of view, if they haven't? Like, if you have to tell one thing or two things, which a healthcare CISO would start looking at it now, what it would be, given 12 to 24 months horizon in the AI security and governance space?
So make sure your data permission access is right. You've got that locked, or as locked as you can. That would be the key one. Understand which of your third parties are using AI in their product, or if they have access to your data on your data, and make sure understand that and keep that up to date. The other one we haven't really spoken about would be, particularly if you're starting to use, if you're using, I think on 12 to 24 month horizon, most people will be using Agentic AI.
Mm-hmm.
How are you getting identity for the agents right? Because a lot of the solutions default to the agent runs with the identity of the user who's kicked it off.
Mm-hmm.
Which means you have no traceability of what that agent did versus what the human did. You need the best practice. Again, I'm not saying we've got to deploy this, but this is where we're trending. Is each agent has a unique identity.
Right.
That way you have traceability of, okay, what did the agent do versus what the human did? Do you understand? Because if something's gone wrong, you want to be able to understand, okay, did the human do something maliciously or accidentally, or did the agent misbehave? And how do we make sure we understand that so that doesn't happen again? If you mix it all into one blob of identity that is the human that's directing it, you can't unpick it.
I think this is a really, really good point. And yeah. And have you got any insights on, in terms of, because I've seen this in organizations where they struggled with is doing specifically the identity and access management for these AI agents. The max they could do was exactly replicate how they were doing it for user, but then it was still under the username, the actual human username, versus the AI agent have its own user ID. And I don't know if you've got any thoughts, any frameworks over there.
I don't yet, I'll be frank, right? In my mind, and my identity team are working on this as we speak, but in my mind, the ideal is the human user can spawn identities for the agents themselves, right? So that's an automated process, rather than just treating it as trying to replicate how you create ID for humans. It's how do you effectively create a sub-identity from the human? Don't have a solution, don't have a technology solution for that yet, but in my mind, that's where we need to get. Because that way you can tie, not just can you tie the agent's identity to the agent, but you also have that link back to the human that is in theory managing that agent. But we are in conversation with some of our technology partners to see, okay, has anyone solved it this way? If not, do they have any thoughts? It's going to be a challenge, but I think it's going to be one of the more interesting ones around AI and agentic AI from a cyber perspective, in my mind. Beyond the use of it to automate and do better in terms of security operations, but that's a different conversation.
Yeah, no, 100% with you. one of the use cases I've seen before with this is in change management, specifically for change testing. And the example I was referring is it was testing on behalf of the user, but then signing off as the user signed off. And then
Mhm.
and then we had the question of going back to that again 75% to 99% principle, where users stopped approving human in the loop piece because all of the test cases were perfect, test output were
Mhm.
perfect, and the AI agent was doing on its own. And we were like, is this a human approved or is this an AI approved? And you can't tell based on the
Yeah,
sign off. So
yeah,
it's an interesting area.
yeah. No, definitely, definitely.
Amazing, amazing. So now we have moved sort of towards the end part of the discussion, and here we have a specific agenda. So what we do is the previous guest left a question for the next guest. So I have a question from the previous guest for you, which I'm going to ask and get your view, and then I will give you a chance to leave a question with me for the next guest. So the question which is left for you was, and it's an interesting question and very open-ended. So in one line, the question is that. So I'll give you the background, because if I ask the one line of you, it doesn't make sense. So in a CISO's day to day, in a CISO's life, every day is like some breach has happened or some incident has happened or something is going on where for that moment they're focused on solving that problem. What if for an entire year nothing happens? Like, what does CISO life look like if for an entire year nothing has happened? No breach, no incident, nothing. Is their budget cuts off? Like, what happens from an organization point of view, and what happens from a personal team point of view if nothing happens for an entire year?
Um, from a it would from a budget perspective, I think it would depend on the organization. I would make the argument that look at how successful our program has been. We haven't had any issues. So we want to at least maintain the level of investment to make sure we can maintain the environment, because in security, standing still is going backwards. I think from a personal perspective and from a team perspective, I think a year without incidents would give the team the headspace to really focus on what are the gaps that we haven't been able to get to. Because there's always something, right? You can never do everything. I think a year without incident would give you, the ability to say, okay, right, there's these 5 things that we know we need to do, but we've never had bandwidth to do them because we've been dealing with incident. Let's get them done. Because it's you're unlikely to get 2 years in a row with nothing happening.
Yeah. I was like, when this question was asked, and this was Maman, who I'm gonna post the podcast very soon, and he's like a World Economic Forum and cybersecurity contributor and things, and he asked this question, and I was like, yeah, like what, like I cannot imagine a day where like nothing happens, right?
Personally, a week of nothing happening sounds restful at this point, but
For an entire year. So yeah, perfect. And thanks a lot for sharing your view. Now it's your turn to leave a question for the next guest.
So, and I will preface the question with, in my view, generative AI is, the current models are synthesizing existing human knowledge, possibly in some cases identifying patterns that others haven't, but synthesizing human knowledge. Do we think, and on what timeline, we'll get to generative AI models actually generating net new knowledge?
Right. It's more regarding the timeline when they start generating the.
Yeah.
Got it. Yeah, it would be very interesting again to hear that. It's again a very open-ended question.
Yes. Well, closed question wouldn't be any fun.
Exactly. Amazing. I think this brings us to the end, and I'm glad that we are ending this on time to give you sort of 3 minutes back. But thanks a lot, Chris, for joining this, and it's really helpful, and it's all the gold and gems which you have shared with all of us. There's loads and loads of decades of learning in there. So thanks a lot for sharing, and yeah, just is really happy that you're part of this journey.
Thank you very much. It's been good fun. Thank you again for having me.